Sarah here, if you could take a look at her. I'm just a bit worried about her.
No problem at all.
Of course.
Hi, Sarah. What's your name?
Hello, Sarah, the doctors are here.
What's your name?
I'm Sam.
Sam.
Yeah.
Nice to meet you, Sam. My name's Henry. I'm one of the doctors, and this is...
I'm Luke.
Hello.
What seems to have brought you in?
I know, darling.
Start having a list of things.
She was playing in the garden with a friend, and then she's just her breathing started going all funny, and yeah.
Okay. Can I ask, has she ever had anything like this before?
No. I mean, she's just like her breathing's all over, and yeah. So I've just had to bring her in and just
Okay. And can I just check what time was this that this happened, or how long ago?
It's about 30 minutes ago, an hour ago, something like that.
Okay. And would you say she's getting better, worse, or staying around the same since it happened?
She sounds very like stridor-y to me, to be honest with you, and that's why I was so worried. Yeah.
Okay.
I know, darling. I'm here. It's not right. Pardon?
Okay. Do you know if she has any allergies at all?
Can we get some blood snippet?
No, I mean, she has
Whereabouts
been
the
in the
adrenaline?
past
I'll start
5
getting that
years.
mixed up.
Adrenaline,
yeah, we've got
we're
some.
beekeepers.
Yeah.
I don't know
If you're happy for me to
what's
if you start
Anaphylaxis. Do you want me to do that?
She's been stung before,
I'll
has
get
she?
access to
Yes,
time to get blood.
Yeah. Okay.
And no
I've got
blood
blood bottles here
Have you
for you,
given her
Doc.
anything at home or since?
No, I've just rushed her straight down here.
Fine. And can I just check her date of birth?
It's on there.
Is that the correct one? Is it
fine,
5th of the 8th, 2019?
Yeah.
Absolutely.
Yeah.
Well,
Fine.
I'm going to need to get a little bit of blood out, so if you can do your best to distract her, make her to look away whilst I'm doing this.
Okay.
Is that all right, Sarah? Yeah, the
So
doctor's
Sarah, this is
here.
going to be quick, I promise.
While he's doing that, do you mind if I have a general kind of look over?
Yeah.
For sure.
Okay, sorry.
Do you want me to do a
So-
set of fob stock? Would that
Yeah,
be
that'd be
If you
grand
wouldn't
as well.
mind, thank you. So,
It's all right, Sarah. I'm here.
okay.
I know. I'm just
Is
standing
it okay if I just have a
here.
look down underneath the sheet and that?
It's all right. It's all right.
Okay.
Is this a rash?
Just pop this on your finger, Sarah. You're doing so well.
I think we've probably got out the twos as well.
Yes.
Yeah, she has got a rash, hasn't she?
Yeah, she-
And her cheeks as well.
Okay. She's got a
Alright,
florid
Kat.
rash. Fine.
All right.
Can we lay the bed down any more than this, or is this the most laid it goes?
Hello, simulation switchboard.
Hello, my name's Luke. Can I put out a paediatric arrest call for, I think we're in A&E.
Okay, AD pediatric arrest call. Will do. Thank you. Bye.
Thanks.
Don't take this off my neck. Right then. So, there's another lesson now we've laid her flat.
Hello, simulation switchboard.
Hello, can I get put through to the P-Switch, please?
Yes, 1 moment, please.
A little bit. Let's bring on
Hello, please, Reg.
Hi, I'm Luke. I'm one of the F2s in PEDS. I've got a lady,
Sorry,
a
I've
little
got
girl
a
in,
cardiac arrest. Is that you guys?
yeah,
Where
that's
are
for
you?
us. Currently in PEDS A&E.
And what's going on?
So we've got Sarah, who's basically a little girl who's been stung by a bee, and is currently going through anaphylaxis. We're just giving you some IM adrenaline at the moment.
Okay, I'm on my way.
Thanks.
Okay.
Okay.
Okay, so just explain what's going on. We think that she's having an allergic reaction to the bee sting that you kind of mentioned earlier. I know she's had bee stings previously.
Yeah, she hasn't. She's been fine. Never like this. I know, darling. I'm here.
Unfortunately, you can have what we say is kind of a sensitizing event. So just over
Okay.
time, they just develop the allergy, unfortunately. But just because of the rational to the breathing, that's our main concern. So what we've just given, as you said, is some adrenaline.
Okay.
That should help to kind of open her airways up and kind of defeat the rash and make her kind of a little bit more comfortable also. So that's what we're looking at on the screen here.
Ready for that
Alright,
fight.
yeah,
I think
Absolutely.
we
Yeah.
need to give some fluids also.
Yeah.
So what we're doing
I
there.
mean,
Peds,
she's
I put on a
ready
pediatric
here, look.
arrest call and I called the Peds Reg. She should be on her way.
Beautiful.
We're just getting a second.
All right, darling.
5 minutes timing now. Second IM adrenaline ready to go if needed.
We've got the second round. Adrenaline's ready. Yeah.
And then while we've got
sent
that,
off,
yeah.
could have taken, because you can get them sent off. That'd be grand.
While we're waiting, can we get some fluids, please, as a bolus?
Yeah, absolutely.
Okay.
Did we get a waiting away in or no?
What's going on?
Hi.
Hello.
Hi. Hello. Oh, dear me. What's happening? There's too many doctors here. Is this a
So-
bee sting?
This is Sarah. It is a bee sting. She's had stings previously with no reaction. This is a sting that happened probably about 35 minutes ago now. We've had our first dose of adrenaline has gone in on the time, obviously, for 5 minutes. Limited response to that. Obviously, it's just gone in.
So we need to get that out, so that's obviously going to be making it worse. So we'll get that out, because that's probably what started it off. We'll get another dose of adrenaline, and then we'll get another set of obs if we can. Do you want to try and get that out? We're just going to get this out.
absolutely. Yeah.
When was the first dose of adrenaline?
About a minute and a half ago.
Right, okay.
The doctor's just going to do
We've got it ready,
something
yeah,
now.
it's drawn up ready, yeah.
And once that's out, can we get another set of obs? Is that all right?
Yeah, absolutely, yeah.
All right, that's it.
Well
Is
done.
that what,
All
is
right.
that what it was, the bee sting?
Yeah, probably. And then I think we need some oxygen on. We haven't got any oxygen on already, have we? We need to get our sats up because they're low.
Okay.
And have we got that other dose of adrenaline?
Yeah.
This,
Should
and
have
this.
just had a deep breath. I think this
All right, Sarah.
Right.
we're up to about 3 minutes now.
Okay. Okay,
We do, yeah.
And we've asked for some fluids, so we can just dive in.
Yeah.
Brilliant.
I'm just going to pop this on, Sarah.
Oh, there we go.
Yeah.
Okay.
All right,
How's she
sweetheart.
doing? Is she,
Another dose going in just now.
10 milligrams per
What's that you're
kilogram.
giving her?
Another dose of adrenaline's just going in now, okay. Okay. Well
The
done,
fluids,
Sarah.
yes, 10 ml per kilo of normal saline it should be. Is that what you've asked
It's
for?
going to be all right,
Yes,
Mr. Doctor.
In terms of the
It's gonna be all right.
So we're giving her the medicines that she needs right now, okay? So she's having another dose of adrenaline. We'll give her the oxygen to help with her breathing.
Yeah.
And the adrenaline should sort her out in the immediate term. She might need some more medicines later.
Okay.
This is what she needs
Yes,
right now.
Oh, you're all right, darling. You're all right.
Okay, so we've got a good response to her stats. So already her oxygen saturation number coming up nicely. We're just waiting for those fluids. Did we manage to get some
Have we
fluids?
got
We're just getting them hot now, yeah.
Thank
You
you.
know what's going to happen? Is she going to be stung again? Is this going to happen?
Just do the age thing. She's 12, isn't she? So
Is anyone listening to me?
So yes, so tell me about that. So you beekeepers?
I'm a beekeeper, yeah, and that's our livelihood. And if she's allergic to it, then what's going to happen? It's just
Okay. So don't worry. Don't worry. We're going to fix this first.
4:30
We're
as a
going to make her
start
well
dose.
today. And then she's going to come onto the ward anyway,
okay.
because she might need some more medicine. She certainly needs a good period of observation.
Can I give you that? Is that all right there?
After
Yeah,
that,
thank
then we'll go through all
Yeah.
of that with you, because it might be that she needs some ongoing treatment
Right.
to minimise the chance of her having another allergic reaction. But we would also be training you how to give the medicine that she's had today at home should it happen again. So
Okay,
we'll go
so-
through all of that.
Right. So you're going to look after me as well and tell me what I need to do. Right. Okay. Okay.
Your blood pressure's coming up a bit.
Good. Okay. So we've had a good response
Okay, I'll just.
to the adrenaline that she's had, which means we've taken away what was causing it, and we've treated what needs to happen in the immediate.
Okay. Yeah.
How are you doing?
Sarah.
Should we,
Touch a bit more.
should we stop there?